Welcome back. We're continuing with the 10 rules of physician engagement, and now we're talking about rules 7 and 8. So beginning with rule number 7. If you want physician engagement, then appeal to their competitive spirit. Physicians by nature are competitive. I'll give you an example. And then my guess is you've probably heard this similar story at other facilities, because this one is a great way to get people engaged. What happened was we were looking at supply costs, in particular we're looking at laparoscopic cholecystectomy, so laparoscopic removal of a gallbladder. We're looking at the supply costs and realized there's wide variation across the system. And we started working with one group, a very large group at one of our larger facilities, and asking them what they want, if they would be willing to help us with this. And they said, look, we really don't have any data on this. So we went and pulled their supply costs, and we let them know what their supply costs were, and we showed them what the costs of items were, and we thought that that was going to change things, and nothing changed. Remember, we gave physicians their data, only their data. We didn't tell them anything about anybody else. And then the next round, what we did is we took the data and we blinded it. We gave them their data, and then we also gave them the data of the other physicians in the group and the averages. But it was blinded data. They didn't know who anybody else was. And all of a sudden, something changed. Everybody started asking, well, wait a second, who is that? And why do they have low costs? And when you look at outcomes, I bet their outcomes are worse. And it's like, no, actually, their outcomes are better, if not some of the best in the system. And people started paying attention because we captured their competitive spirit. They said, wait a second, somebody's getting better outcomes at a lower cost than me. How are they doing it? And the group decided to work together. And they figured out that what they wanted to do as a group was to standardize their preference card and really focus on the type of preference card that seemed to be associated with the best outcomes and the lowest costs. And they took them a while, but they were able to do it. It took them about 3 months to finally piece it all together. And the reason why they wanted to do it was not only obviously for, again, appealing to that patient care, because they wanted to make sure that their patients were getting the best outcomes, but they wanted to be able to market themselves as the high-value physician group who could provide this operation and get better outcomes at a lower cost. And so it's interesting. Here they are, sort of the self-preservation thing. But how they got there was through their competitive spirit. They started looking at each other and going, well, how's that person doing better than I am? And I want to do better than them. So how do I do that? But then they joined together as a group and said, hey, if we start to bring our resources together and look at this, we can do better as a group. And that's going to be better for not only us, but for our patient care. So another way to get physician engagement, appeal to their competitive spirit. Rule number 8, if you want physician engagement, empower them to create their own solutions. And how this one came to be was I was having a conversation, and someone pointed out that one of our groups was getting, they thought were less than ideal outcomes, particularly in terms of their complications. And I knew this group. I had been involved in peer review, and I just said, something's not right. I can't believe that their complication rates are that high. And again, we were using, at the time, the data out of Premier, risk-adjusted and benchmarked across the country out of the SELECT database. So I said something just isn't right. They're just too good of doctors and surgeons to be getting that kind of bad outcomes. And I was sitting next to one of our clinical documentation specialists, and she said, no, they don't have a bad clinical practice. They just have a bad documentation practice. And I thought, wow, this is interesting. How do we get them to change this? And so without even any of that prompting, I just said, you know what, I'm going to meet with them. And I met with the group, and I said, well, what do you want? What are you trying to accomplish? And I said, well, we want to be known as the go-to group in this particular region of the state in which they were practicing in. And I said, great, well, how are you going to do that when your complication rates are so high? And so I showed them the data. And one, they couldn't believe it, and I just said, I understand that, but I don't think it's your clinical practice that's the problem. I think it's your documentation practice. And they said, tell you what, if you will track this stuff for us and look at it, we will be willing to do something about our documentation practice. In fact, actually, we would like to set up some time to meet with folks. Now, you got to remember, these guys were, like a lot of physicians, they get these queries and they just completely ignore them, from the clinical documentation specialists. And this changed their mindset on this, and sat down with the group. And we came up with a sort of a 1-hour course to take them through in terms of how to update their documentation. And sure enough, it was a documentation issue. It wasn't a clinical practice. And so as they sat down and worked on this more and more, they began to work more and more with their clinical documentation specialists. In fact, they invited them out to their office to help them with their documentation in their office and work with their coders to get their documentation up to snuff so that they can truly get represented in the data. And sure enough, in a very, very short period of time, we saw this complete reversal. They went from being, at least in the database, one of the worst group of surgeons out there to one of the best in the country in a risk-adjusted manner and benchmarked, again, with the select data out of Premier Database. And that was purely because it was a documentation issue. It wasn't a clinical practice. And now all of a sudden the clinical practice is getting projected out there in the public space is truly representative of what they're truly doing for their patients. Again, trying to make sure that what they're doing for their patients, their good quality care, is getting known in the neighborhood out there, so to speak, so that the patients understand that they really are delivering that quality of care. And also their reputation is intact from this. Little did they know that their documentation was impacting their reputation as surgeons. And once they did, all of a sudden they were willing to take the bull by the horns and really start to do things to create solutions on how they wanted to recover from this. So it was interesting to watch them do it. They literally went from completely disengaged and had no interest in any of these queries or changing anything about their documentation practice to being highly motivated to do it. But not only that, but starting to create their own plan about how they were going to attack this and how they were going to improve it in a very short period of time. And it says the 10-month outcomes, but that's just what we ended up publishing. We saw turnarounds in as little as 1 month with this plan. So it was fascinating to watch this, how all of a sudden, when you let them take the reins and let them be the ones who are going to develop their own solutions, they created a solution and were able to turn this around in a very, very short period of time. Highly engaged. Not only that, but this helped the organization. It's interesting, because they were doing a better documentation with things like present on admission diagnosis and making sure that they were documenting everything accurately. What we found was they not only improved their workflow and they were able to bring in more cases, but the hospital generated a pretty significant return on that investment simply by helping physicians be better documenters. So worth the investment, and particularly when you've got physicians who are willing to do it because they're doing it for the right reasons, reasons that are important for their practice, but also for their patient care. So that's rule number 8. And we will be moving on to our last and final section, rules number 9 and 10.